So what happened is in November of 2000, Amendment 20 passed in Colorado, and Amendment 20 was an amendment to our state constitution, a pretty big deal when you think about it. And basically, a small enterprise was envisioned because most of the people in Colorado that voted in favor of medical marijuana thought it would be a small number of patients who had catastrophic illnesses that didn't respond to conventional treatments that would be looking to have marijuana legally to treat their ailments without getting in trouble legally. So rules and regulations were developed, and basically, the bottom line was for a patient to have a medical marijuana card that would allow them to be in possession of marijuana, they had to have a debilitating condition, and I'll define those up the line, and they had to have a bona fide relationship with a physician, and that physician had to make the recommendation that marijuana would in fact likely be helpful for their condition. Then in 2009, a couple of things happened with the federal government. Basically, there was a message, this was unrolling in Colorado, that we're going to take a hands-off approach. As long as people follow the letter of the state law, the federal government won't get involved. And one of the things we made a mistake on early on is we didn't limit the number of caregivers. The caregivers can each grow 6 plants for a patient. So imagine a patient having 6 caregivers and 36 plants of marijuana. That's probably much more marijuana than they need for any medical condition. So we started seeing applications coming in, meaning a patient would see a doctor, the doctor made a recommendation and signed an application. The patient would then enter into the Board of Health, or Colorado Board of Health, and then they would be issued a card. And can you go back real quick? Just to show you how exponentially this grew. Oh, thank you.
Get real close to it.
Okay. Is that better? Oh, yay. Okay. So in September of 2009, there were about 3,500 applications per month, 3,500 people in the state of Colorado per month wanting to get a medical marijuana card. And that number jumped to almost 130,000 by July of 2011. So over 2 years, we saw this exponential growth in people applying for medical marijuana cards, okay? And this slide shows it a little bit better. In the blue, you can see the applications in the year 2009, and in red, you see the applications in 2011. And same with the valid ID cards, big exponential jump, and you can only imagine how employees at the Department of Health were jumping to try to accommodate this burden of applications coming in, okay? And when this amendment passed, these storefront medical marijuana dispensaries literally sprouted like weeds, and the pun is intended on my part. And this actually was in the Denver Post, where it said there are more medical marijuana dispensaries in Denver than Starbucks and liquor stores combined. And I can promise you there are a lot of Starbucks and there are a lot of liquor stores in Denver Metro. I also include this slide that, it seemed like a really good thing that during a time when the country was in a pretty serious recession, this particular industry was not at all. And there was plenty of money to be made, and still plenty of money to be made, because there were the growers, the caregivers I mentioned, there were the legal counsel, not many attorneys in Colorado, but a handful did a lot of consultation to dispensary owners and caregivers, and actually the same attorneys helped implement the law. And then all the paraphernalia, more recently delivery services have evolved, so people don't even have to leave their home, it's delivered to their homes. And then armored trucks, which kind of surprised me, but the issue is because this is still illegal under federal law, the banks don't want to touch this business. And so the dispensaries have cash businesses, and they store the cash that they make from the sale of marijuana in safes and use armored trucks to deliver that money to safes away from the dispensary. And we're seeing a little bit more of this now, and I'll go over in more detail some of the impact in Colorado from the legalization of marijuana. We're actually seeing many more detox services emerge, and also more emergency room visits and hospitalizations directly related to the use of marijuana. These list the debilitating conditions that Amendment 20 covered and continues to cover for medical marijuana. And you can see the top 4 at least are conditions most people thought we would be looking at. These are people who have severe wasting from serious illness, or they suffer from severe pain that's not responsive to other kinds of medication. They might have cancer and have a lot of nausea from chemotherapy, or HIV/AIDS. And the bottom conditions, persistent muscle spasms, or glaucoma, severe pain, are other conditions that are on the registry. I've followed this from its inception, partly because I'm a physician and I'm concerned about my patients, but partly out of curiosity, because this was such a novel thing that was unfolding in Colorado, and we were the first state and nobody really knew where all of this was going to go. But what I found is I started following the people who were getting medical marijuana cards. They were predominantly young men in Metro Denver, and there were about 800 physicians on average that actually were making the recommendations. And some of them may have made one recommendation, others made hundreds of recommendations. And just to give you some perspective, there are 17,000 physicians licensed in the state of Colorado, so a relatively small number who have engaged in this enterprise. I've listed the conditions again. I collected this information this spring, just showing the spread of where the medical marijuana cards are going. And what I highlighted in red is important. Muscle spasms, severe pain, severe nausea, they're all very subjective conditions. I can measure if someone's having a seizure. I can test someone to know if they've been exposed to HIV. You definitely can diagnose cancer through imaging studies or blood tests. But these other conditions, who am I to tell you how severe your nausea is or how severe your pain is? And it's probably not coincidental that the majority of the cards are going to severe pain, okay? So this was my conclusion, that either we have this epidemic of severe pain in young men, or the amendment was being exploited by recreational users and certainly people who are poised to profit from the industry. I also was interested in sort of the profile of physicians who were involved in making recommendations. And again, it was, it's been between 700 and 900 physicians all along that get involved, and that's a small percentage of all physicians in Colorado. But it was 15 doctors that were making 3/4 of the recommendations, and 5 doctors out of those were making 50% of the recommendations. So it's a very small number writing a lot of recommendations, and really, it just spells out an incentive for profit more than treating patients. I've talked about one doctor who actually had his license taken away because he wrote 3,500 certificates or recommendations over 2 days. And it was at basically a concert attended by many young adults at a Red Rocks amphitheater. And he just sat outside for 2 days, spreading ink on these certificates. And it was very clear to the Board of Health and our medical board that this was not legitimate medicine. Okay. So given that things were kind of loose with Amendment 20, we didn't anticipate certain things, Senate Bill 109 passed in 2010, and this basically tightened up some of the legislation. One, it really defined what a bona fide doctor-patient relationship was. It wasn't the guy at the concert just writing out certificates. You had to actually evaluate the patient, obtain records to know about their past care, have a chart on the patient, see them in follow-up. So it really tightened that up. And there was also the decision that any physician engaging in this practice should have an unrestricted license, meaning no discipline, no restrictions because of questions about their competency.